Next, we want to talk to you about myths and misconceptions. And these are things that just about everybody has when it comes to alcoholism and drug addiction, chemical dependency, enabling, and the dynamics of the family. These are the myths and misconceptions that really lead to inaction. They're the things that we tell ourselves that really freeze us in place and stop us from taking the construction action that we need to take.
You know, what you're saying, Jeff, is so important because before we can intervene, we really must examine our beliefs because our behaviors follow what we believe. If we believe there's nothing we can do to help our beloved alcoholic or our beloved drug addict, we do nothing. And what I'd like to do right now is start out by talking a little bit about the three most damaging myths, and I think the most commonly believed myths in our society and in our families. And the first one, which I think is the most important myth to debunk, is the myth that says you cannot help an alcoholic until he wants help. You will hear that repeated over and over again. I have certainly heard it among family members, among friends. I've heard it among professionals, doctors, even recovering people. But what no one ever talks about is that when we say you can't help an alcoholic until he wants help, the silent part of that myth is therefore there is absolutely nothing you or I or anybody else can do about the problem. So we just have to step back and allow addiction to run through our family like a freight train, damaging everybody, even the smallest children. What we like to say is we like to change this myth a little bit, and we like to say, if you can't help an alcoholic or an addict until they want help, what will get them to want help?
Changes everything.
It sure does, because now it opens the door to possibility. When we ask that question, it brings us to a place of looking, investigating, finding out what can we do to help move this person we love into accepting the help they need. Changes everything, absolutely. The second most common and most damaging myth is the old idea that an alcoholic or an addict has to hit bottom first. And you know, there was a time this was true. Prior to the 1960s, we didn't have intervention techniques, but it's no longer true. And there are a couple things I want to talk about with this myth, because it seems to make such good sense. First of all, there's an idea that when alcoholics hit bottom, that they immediately are either struck sober or they go dashing off to the nearest treatment center, and anything is further from the truth. In fact, alcoholics and addicts can bounce along the bottom for years. They hit bottom, they're very resilient, there might be family members or friends that rescue them, the pain goes away, and they're off drinking or drugging again.
If you can even define what that bottom might be.
What that bottom might be, absolutely. And of course, for a lot of people, every single day, that bottom is prison, the bottom is insanity, the bottom is death. About 350 people a day die from chemical dependency. It's the bottom with no bounce. But the other thing about that nobody ever talks about when we say the alcoholic needs to hit bottom is the family goes along for the ride. Alcoholics do not hit bottom alone. The whole family hits the bottom with them. And again, I can't stress enough that this also includes children in families. So terrible things happen to the family. It's simply not okay, because we cannot say that the solution for the alcoholic is the undoing of the family. So with intervention, what we want to do is we want to raise the bottom today. We don't want all those future negative consequences to happen. So we're going to raise the bottom and get them to help today. The third most damaging and common myth is the idea that if somebody doesn't want treatment, it will not work. Again, it's so common because it seems to make such great sense.
But it's wrong.
It is wrong. And the truth of the matter is this. It's not how you get into treatment that counts. It's what happens once you're there. Anyone who's working in a treatment center is going to tell you, one day the person in treatment is going to be so happy. When I worked in inpatient treatment, you never knew from day to day. One day somebody would be saying to me, I'm so lucky to be here. This is the greatest experience of my life. The next day I arrive and that same patient is like a caged animal. I hate this place. I want to get out. So there's this very up and down emotional experience that's happening because the brain is detoxifying from the drugs. What we know is that it is not how you get into treatment that matters. It's what happens once you're there.
In fact, there's long-term studies that show that there's virtually no difference between people who are court-ordered into treatment and those who go into treatment, quote-unquote, voluntarily. The fact is, no one really goes into treatment voluntarily. There's always something that happens, something that intervenes. It might be the law, it might be a medical problem, it might be an impending divorce or job loss. There's something that's intervening to get the person into treatment right now. Of course, what we want to do is have an intervention that's more loving and more caring and not catastrophic like those other kinds of interventions.
Exactly, because when we intervene, we have more control over the circumstances, and we're not leaving things to chance.
Of course, it can be difficult, and there are rationalizations. Part of the misconceptions that we have are rationalizations. We say, well, we don't think that he or she can be an alcoholic because he doesn't drink every day. I mean, he doesn't look like an alcoholic. There's sometimes that he or she are in perfect control. But that's the nature of alcoholism and drug addiction. Many alcoholics will quit for periods of time. For a week or 2 weeks or even a month, just to prove that they're not alcoholics. It's really not about how much you drink or how often you drink. Other people will say, you know, he's not an alcoholic because he always goes to work. She's not an alcoholic because she takes such great care of her home and her children. Again, it's not how much you drink, it's not how often you drink, it's what happens to you when you drink.
And you know, about 95% of alcoholics and addicts have jobs. I mean, they tend to be employed. It's not until they get to the very late stage or end stages of the disease that they typically start having trouble with their employment. You know, another one of the myths that's so commonly believed is that the biggest problem we have in this country is with illegal drugs.
Not true.
And it's, again, not true. And I think part of the reason is we've had what we've called the war on drugs, and it's been covered a lot by the media, and they really don't talk about alcohol because alcohol is, for people over 21, is a legal drug. But the truth of the matter is alcohol is the biggest drug problem in this country. We probably have about 10 alcoholics for every one drug addict. And sometimes families think, oh, well, it's only alcohol, so it's really not that bad. But actually, alcoholism has a profound effect on the entire body and the brain, and it's considered one of the most damaging drugs to the human body. Another myth that we commonly hear, not just families, but we hear it from doctors and we hear it from counselors who are not trained in addiction, is the myth of willpower. Even when people say, oh, I understand it's a disease, when they really start talking, you can hear it in the language, well, you know, when is she going to learn? Or, you know, when is he going to finally get his act together? Because we think somehow if you exert enough willpower that you can overcome this problem. But the disease of addiction, and it's a brain disease, we understand that today. And again, we'll talk about that later in this workshop. Fascinating stuff that science knows now about what happens to the brain. But that this disease resides in a place beyond the will, beyond the conscious mind, and beyond the power of our will. I always say alcoholics and addicts have tremendous willpower because they have managed to function as well as they do, although over time that goes down and down further and further. But they function so amazingly well in spite of the fact that they're dealing with this chronic progressive disease we call addiction. Mm-hmm.
Another misconception that families have, or a rationalization that they use, is to say, you know, it's not my problem. He's got to deal with it, she's got to deal with it, it's just not my problem. But this is a function of family denial. This is once again taking us out of the picture and saying, well, you know, until he hits bottom or makes a decision, there's really nothing that I can do about it. The fact is, though, if the person was suffering from schizophrenia or had just had a heart attack, we wouldn't say, well, it's his problem, he's got to deal with it. And chemical dependency is really that way. Until the person suffers catastrophic consequences, and often even then, they do not take any action. So we as family and friends need to step forward, need to intervene and get the person to the help that they really need.
And you know, Jeff, oftentimes family members don't realize how much their loved one's addiction is affecting and changing them. So when we talk about it as just being the alcoholic's problem, That's really not the way to think about it. We really see it as a family problem because it affects everybody involved in ways that they often don't see in themselves. And I'd like to talk about a couple other myths that go hand in hand. One is the idea, and this can really confuse families. One is the idea that, if you're an alcoholic and you go to treatment and you're in recovery from an addiction to alcohol, that you can use other drugs. And oftentimes, if people aren't working in a program of recovery and they're being kind of tricky, they'll say to their family members, oh, well, alcohol was my problem, but it's okay if I smoke marijuana. Or, it's all right that I'm taking this Valium or these mood-altering drugs that my doctor gives me because, my problem is alcohol. But the brain doesn't doesn't make a differentiation between these drugs. Once the brain becomes addicted, it will react the same way regardless of what the drug is.
And I've seen families unwittingly sabotage a person's recovery. Say they go into treatment for cocaine addiction and they've been clean from the cocaine for 6 months and they're invited to the backyard family barbecue and Uncle Al says, oh, I'm so proud of you, you're doing great, why don't you have a beer? Well, the person may have not had a problem with alcohol before, but because of the phenomenon of cross-addiction, that beer is going to cause a bone-crushing craving for cocaine within 24 hours. And Uncle Al has just unwittingly sabotaged the recovery that person was experiencing.
Which brings us to the other part of this myth. If you're recovering from drugs other than alcohol, it's not okay to drink for just the reasons that Jeff is saying. It may lead to cravings to what we call your drug of choice, or over time, you start having problems with alcohol. And this is called cross-addiction. And also, it's important to realize that in treatment, people don't learn how to drink socially. Sometimes people come into treatment for alcoholism and they think that's what's going to happen. They're going to teach me to drink like everybody else. But again, remember, we talked about the fact that this is a chronic illness. There is no cure. The brain will always go back into the addicted state. And in Alcoholics Anonymous, they describe it this way. They say, once a cucumber becomes a pickle, it can never be a cucumber again.
And that's a fact. So there are some things that I want to talk about as far as misconceptions and rationalizations go that are really specific to the alcoholic or drug addict. They're really like little mantras that run in the person's mind. And of course, a mantra is like a little silent prayer. In fact, it's interesting, the definition of a mantra is a mind protector. And these rationalizations are not just mind protectors, they're addiction protectors. They're the things that we as alcoholics or addicts tell ourselves that kind of keep the addiction firmly in place. One of the things I think that is first and foremost is that we say that our use of alcohol or drugs is not what's causing a problem in our life. It's the wife, it's the job, it's the stress, it's the money problems, whatever it is, but it's not my use of alcohol or other drugs. We always rationalize away from that. In fact, we even take it a step further and say that alcohol or drugs can't be the problem because for me, as the person who's drinking and drugging, they're actually the solution. They're the only thing that gives me that respite from the terrible stress in my life or whatever it is. So it can't be the problem because it's the solution. And anyway, here's another one. And anyway, I'm still in control. I'm still going to work every day, or I'm, making lunch for the kids and dinner and cleaning the house or doing whatever it is. Different people have different rationalizations and different things that say that I am still in control. Typically for men, that's going to be something that's around work. We can't say that he's an alcoholic. He's never missed a day of work in his life. In fact, for men, work is the last thing to go. For women, it tends to be things around children and home. As long as they're still taking care of the children in some way, they think that they can't really have a chemical dependency problem. They'll also say, I know there might be a problem. I know this is kind of bad, but I am functioning pretty well. And anyway, I've got more time. I'm not really suffering from cirrhosis of the liver yet. Although I've got to tell you, I had one terrible case where I had a young woman, youngish, I should say she's in her 40s, and she had terrible cirrhosis. She was in fact in a hospital in critical care, waiting for a liver transplant, hoping to get a liver transplant. And we had an intervention right there in the hospital, brought in 10 family members. And we had a terrible time. Finally, though we did get her to agree to go into inpatient treatment once she was discharged from the hospital. Well, unfortunately, she never made it that far. She died while she was still in a hospital at that young age from complete liver failure. And so she did not have the extra time that she thought she might have.
Well, and you know that I always think about that woman and her family because it really is such an example of the alcoholic mind and how much they protect the addiction with these kinds of mantras. And I always tell family members when you're doing an intervention, somewhere in that alcoholic's mind are going to be those two mantras. You know, I'm still really in control and I still have more time. And even this particular case of this 45-year-old woman, literally on her deathbed, she still believed those things. So it's really interesting that these mantras, which alcoholics and addicts say to themselves silently and they say out loud to their family members and they get their family members to believe them, but the alcoholic also definitely believes these lies.
Yes, and they really believe that it's only through the use of the alcohol or the other drugs that they're really able to get their creative juices flowing. They think they're funnier, they think they're sexier, they think that they're more attractive in every way. When, of course, if you've ever had to spend time with somebody who's really intoxicated, it's probably the least attractive thing that you'll see.
And you know, a personal story is I intervened on a very good friend of mine and who ended up going to treatment. It was very successful. She was very sober. But before she went to treatment, she was really afraid she wouldn't be funny anymore. And she didn't realize how very unfunny she was in her alcoholism.
Mm-hmm. Because alcoholics are also always rationalizing that their situation is unique. Yes, other people might need treatment, other people may need help. I know that I may be over drinking or using drugs I shouldn't be doing, but you don't understand. I'm so different, my situation is so different that it calls for some other kind of understanding. But look, the real case is that this is an illness, it's a disease, it's been recognized that way for many years, and it requires professional treatment to bring people back to who they really are and what they can really be.
So it's important to see both on the family side and on the addict side that there are these myths and these misconceptions, misbeliefs, and they keep everyone from taking action. They keep the family from intervening, and they keep the addict in their own mind thinking that everything's all right, that they don't need to accept help. In fact, they'll actively work against anyone trying to get them to accept help.
And it's interesting because both the family and the addict, by believing these lies, by believing these rationalizations, it comes to a place where they both use it, both family and addict use these rationalizations to manage things, to keep the patina of normalcy over the family. So, well, yes, he's still going to work, she's still taking care of the kids, whatever it is. It becomes this method for managing chaos.
And remember what we said, that this is a progressive disease. So if there is no treatment, over time it always gets worse. And just as Jeff said, the families will start normalizing things. They'll live in conditions and situations that they never in the past would have believed they would have put up with. And the same goes for the alcoholic or the addict. Their life is going downhill steadily, but they continuously normalize it. Wherever they're at in their addicted mind, it's okay, whether it's the father who comes home every night and has several drinks until he passes out, night after night, no time with his family, no time with his children, and that becomes normal. Or we could go all the way to the other extreme and see people, for instance, we had one case, a very successful attorney who ended up living in his car in the inner city of Detroit, smoking crack cocaine. And, you know, he still didn't want to accept help until his family moved in and did a very, very loving intervention. Because for him, even though he was living in his car, lost his job, lost his prestige, it had been normalized through his addiction.
He was still able to put on his tie and walk into the county courthouse and do what he needed to do to keep his practice kind of hobbling along a little
limping
bit.
along, yes.
That's
so in
right.
his mind, with his addicted mantras, he was telling himself that was still normal.
As we go forward with the program now, we'll be, as we talk more about intervention and techniques that families can use, we'll help you to overcome these myths and misconceptions, and really you'll start to do that already just by understanding them.
And next, you'll be with Jeff, and he's going to talk to you about enabling.